For a city of over 1.2 crore people, Bengaluru had been reporting the least number of COVID cases compared to other metros in the country. So, the city did do several things right. But with a total of 260 new cases reported so far in June, are we looking at the beginning of a spike? The first phase of infections in Bengaluru were from international travel. On March 9th, a software engineer in Bengaluru became the first man from the city to be tested positive for COVID-19. He had returned from the US via Dubai and slipped through the cracks when he landed in the city. The screening strategy did not include the US at the time. His family, including his 13-year-old daughter, soon tested positive for the virus. The authorities responded by shutting schools up to class 5 and contact tracing began. 2,666 people who had come into contact with the man were identified and 2 were found to be symptomatic. Soon, up to 100 teams consisting of 1 community medicine doctor, 1 staff nurse, and 1 medico-social worker have been formed in the BBMP areas for contact tracing. On March 11th, Karnataka became the first state to invoke provisions of the Epidemic Diseases Act of 1897. Within the next 2 days, the state government announced a 1-week closure of malls, cinema halls, marriage halls, exhibitions, and other public events, following India's first COVID-19 death in Kalaburgi. The state went into lockdown on March 22nd, a day before the nationwide lockdown was announced by the Prime Minister. In April, the focus shifted from international travelers as flights were suspended to the emergence of COVID-19 clusters in the city. The first Tablighi Jamaat COVID positive cases were discovered in the city on April 6 in Padrayanapura. This ward and Bapuji Nagar were completely sealed off on April 10th and the BBMP began door-to-door surveillance. Elsewhere, 35 people were infected in a separate but large outbreak in Hongasandra by April 18th. On April 24th, the Ministry of Home Affairs permitted commercial establishments except malls and shopping complexes to start operations. The same day, Karnataka reported 14 fresh cases, the biggest spike for April. Following this, the state government continued with the lockdown and commercial activity was not allowed. As April ended, only 38 out of 198 wards in Bengaluru Urban District were identified as hotspots by the War Room. According to official data on April 30th, more than half of all cases were primary contacts of previously diagnosed patients and 13% were SARI-related cases. Contrary to popular perception, only 3% of all the city's cases were attributed to Tablighi Jamaat according to the data released by the government. The situation appeared to be under control until the opening of interstate and inter-district travel, which caused the floodgates to open. The lockdown was relaxed on May 3rd following the center's guidelines for Lockdown 3.0. On May 9th, 12 of 36 cases in Karnataka were detected in Bengaluru alone. Officials disclosed that many travelers had breached city's borders without a health screening. As the month of May drew to a close, a massive cluster erupted in Shivajinagar. A man working at a quarantine hotel had infected 47 others in his building. The official data on May 31st points to primary contacts contributing up to half of all cases. 13% are secondary contacts, while 11 are attributed to travel history. And the percent of Tablighi Jamaat related cases had dropped to 1% according to the official data. Restrictions on interstate and inter-district travel were eased further after the center released fresh guidelines, which was termed Unlock 1.0 on June 1st. While Maharashtra returnees continued to contribute to a major share of spike in COVID positive cases in the state, Bengaluru wasn't affected much by this. The city, however, seemed completely unprepared for the flood of ILI and SARI cases that were soon to follow. Just when BMTC buses were back on city roads, a driver-cum-conductor tested positive on June 10th. The BMTC driver traveled to Kalaburgi and Vijaypura, both districts where cases have skyrocketed due to those returning from Maharashtra. Bengaluru reported its highest single-day spike with 42 cases on June 10th. A staggering 23 of these were ILI patients. 6 other cases were returnees from Maharashtra and 1 each from Tamil Nadu and Haryana. Between June 7th till June 11th, every 3 out of 5 patients tested in the city had influenza-like illness. But restaurants, shopping malls, places of worship, offices, parks, and even zoos had already begun functioning since June 8th as part of Phase 1 of Unlock 1.0. The state government decided to stop testing the dead who showed symptoms of ILI and SARI, but the decision was reversed on June 11th as the issue snowballed into a controversy. Karnataka is possibly staring at a severe shortage of testing kits. While a whopping 95% of all cases in Karnataka are reported as asymptomatic, many with mild symptoms are being turned away without a test at fever clinics. This trainee doctor at a government hospital in the city said that the situation is hopeless.
See, we don't have enough kits. Okay. Enough test kits to do. So that is when the proper case who is in need of it, doesn't get to, it will be very unfair to them and unfair to the government too. So that's what is the issue.
Do you think that we're heading for like a dangerous time ahead? Much more dangerous than what it is right now in terms of spread and...
The government has left us. See yourself, do by yourself. Be safe by yourself. Your health is yours. You have told us also. See, your health is yours. Do whatever you want.
They told that to the doctors.
That's what. They left off like that. They opened the community, everything. They opened the pubs and bars.
When we reached out to multiple private labs in the city, which are listed by ICMR, this is what they had to say.
Done quickly. Would that be possible?
Sir, we are not conducting COVID tests for outbreaks, sir, only for the inpatients, that too in access to the public.
I'm wondering if I'd be able to drop by and get a COVID test done.
Sir, COVID test in our hospital they are not doing. It's only for the inpatients.
Okay, it's only if people are admitted at the hospital, is it?
The one who is getting admission or getting operated.
Okay, because I kind of have a fever and a sore throat, and I have
You are called to the government helpline number, sir. They'll help you in that.
Okay, sure, ma'am. So I won't be able to drop by and get a test done, even though I'm showing symptoms, is it?
No.
Okay, thank you.
A fact-finding committee report points out serious problems with 3 COVID-19 hospitals in the city: Victoria Hospital, Rajiv Gandhi Institute for Chest Diseases, and Bowring and Lady Curzon Hospital are facing a grave shortage of medical staff and beds. Bengaluru's 4th COVID-19 hospital is still months away from completion. There are no anesthesiologists and intensive care staff to operate ICUs at Rajiv Gandhi Institute for Chest Diseases, which is among the city's designated COVID-19 hospitals. Appointed by the state government, the committee has recommended that Victoria Hospital continue as a dedicated COVID-19 hospital. However, more than half of the beds at Victoria Hospital are recommended for non-COVID care. While those seeking treatment for non-COVID diseases have fewer hospitals to go to, the exit strategy to combine COVID and non-COVID patients could spell fresh trouble for everyone. While Karnataka was at the forefront of the COVID-19 fight back initially, the number of containment zones soared to 191 on June 15th from 36 at the beginning of the month. With this, a whole new set of challenges have swamped the fight back for Bengaluru.